Good morning. I'm James Williams Jr., Director of Federal Affairs for Cancer Prevention, Early Detection and Screening for the American Cancer Society Cancer Action Network. We want to thank you for joining us in today's webinar, and we're proud to partner with the National Hispanic Medical Association's webinar today that's on exploring clinical trials and cancer screenings. We have stories from cancer survivors and experts, and today you will hear insight on this subject from Congressman Raul Ruiz, a doctor who sits on the powerful House Energy Commerce Committee Subcommittee on Health, Dr. Estelamari Rodriguez, who is Associate Director of Community Outreach at the University of Miami Miller School of Medicine, and Dr. Juan Santamaria, an Assistant Professor of Surgery at the University of Nebraska Medical Center. ACS CAN and NHMA, thank you again for taking time for today's webinar. And as we go to the next slide, you'll see me. That's a picture of me. I'm a two-time cancer survivor, and I like to say 40 pounds and an afro ago, I was diagnosed at 39 with prostate cancer after my late wife urged me to do so. I had a radical prostatectomy, and then my doctor said that I needed to be in a clinical trial because I would help the treatment of others who got a cancer diagnosis and possibly save lives. And if I were not in a clinical trial, the recurrence of my cancer 4 years later might not have been diagnosed in time. Indeed, the surgery and treatment for prostate cancer from 1999 and the radiation I had in 2004 have significantly improved, and I hope that my participation in a clinical trial, which lasted about 18 weeks over a decade ago, helped a little bit. And as we go to the next slide, just want to let everyone know that while this is an interactive forum, we do have a few rules. All mics will be muted, but please use the raised hand feature to be unmuted or simply type your question into the Q&A box. This event is recorded, and you can go to nhmamd.org or it'll be sent to you. Today, we're fortunate to have three doctors who have taken the time from their busy schedules with us today and to hear from them each for about 5 minutes as they give us an overview. And I just want to quickly do an introduction of everyone. Dr. Raul Ruiz also represents the 25th Congressional District of California in Congress. The son of farm workers, Dr. Ruiz graduated magna cum laude from UCLA and earned both a medical degree and a master's of public policy at Harvard. He returned home after his medical training and became, among other things, an emergency room doctor, starting a pre-med mentorship program, serving as associate dean at UC Riverside School of Medicine before becoming a member of Congress. I want to start off with Congressman Ruiz. I know that you've got a very busy schedule before you today, and I'll go into introduce Dr. Estelamari Rodriguez and Dr. Juan Santamaria after you give your remarks, Congressman. Congressman, thank you so much for joining us today.
Thank you, James, and thank you for sharing your story, and congratulations. You're a strong survivor, and you're paying it forward, and you're making a big difference for so many others. Good afternoon, everyone. I'm Congressman Dr. Raul Ruiz. I want to thank the National Hispanic Medical Association, of whom I've had a relationship and I have participated in since my pre-med or medical school years. So that was quite some time. I've had a long-term, wonderful relationships with the organization. I also want to thank the American Cancer Society Action Network for hosting this webinar on such an important topic. As some of you may know, I'm an emergency medicine physician, and for years I've treated patients in my home community and the district I represent in the Coachella Valley. Treating patients primarily in rural, underserved, and underrepresented areas, I've seen the real need of improvements in our healthcare system. That is one of the main reasons I ran for Congress to begin with, and it's what I've been doing and working on ever since. So for over a decade, I've been fighting for legislation to improve access to high quality, affordable care for all patients. And that includes making sure we have a robust healthcare workforce to care for patients, an increase of screenings for disease, and the development of innovative treatments and medications. But I would argue, most importantly, that means making sure patients have access to treatments and screenings that work for them. This past May, along with my colleague, Dr. Bouchon, I introduced the Bipartisan Clinical Trials Modernization Act. This bipartisan legislation builds on the success of clinical trials legislation passed into law last Congress to address economic barriers that can prevent participation in clinical trials, especially in underserved, underrepresented communities. Removing economic barriers is a key component in facilitating meaningful patient engagement. We all know that to ask a person who is working poor to take time off of their work or to spend their money on gas, on travel to a facility, or to spend the night somewhere where they need to be observed is cost prohibitive. So this bill allows for an increase in clinical trial enrollment from a wide variety of populations in these communities, including the families and individuals that I serve in California's 25th district. The Clinical Trial Modernization Act also allows the U.S. Department of Health and Human Services to issue grants or intercontractual arrangement to support education and outreach and recruitment for clinical trials for diseases that have a disproportionate impact on underrepresented populations. And as an emergency medicine physician, I know firsthand that individuals respond differently to medications and clinical treatments. So it is important that participants in clinical trials are representative of the populations that the new treatments are intended to benefit. And that is why this bill is so important, especially in the cancer treatment space, where we are seeing exciting new innovative treatments being developed. So I'm deeply concerned about the potential effects that the lack of diverse participation in clinical trials may have on effectiveness of new medical treatments and therapies for underrepresented populations. Look, when we look at new data that comes out on any treatment modality, we always look at the methodologies, and we always, in those of us that have published, look at the demographics of the population that were studied, so that we can extrapolate whether or not our specific patient is reflective of this demographic or this population that the tests were tested on. So it's very important that that especially the underrepresented populations that suffer the greatest disproportionate impact of the burden of disease, that they're the ones that are also included in the clinical trials, so that we know that the treatment works for them as well. So that is why I introduced this critical legislation to help ensure clinical trial results are applicable to our nation's various populations and can lead to more effective treatment. So thank you for what you're doing. Thank you for bringing awareness to this important issue. Thank you for supporting this piece of legislation. I will continue fighting for this bipartisan legislation to give patients better access to the screenings, medications, and treatments that they need. Thank you, and I yield back the time.
Thank you so much, Dr. Ruiz. As a 20-year Hill staffer, I just want to thank you so much, not just on behalf of being a Hill staffer, but also thank you on behalf, you have been one of the strongest supporters of the American Cancer Society Cancer Action Network, which is a nonpartisan organization. We seek public policy solutions that are scientifically based to lower the burden of cancer for everyone. So not just in this issue, thank you so much for everything you and your excellent staff have done. You can't be an excellent member of Congress if you don't have an excellent staff. So thank you so much. Thank you. Appreciate it.
Thank you.
Dr. Juan Santamaria is a surgical oncologist, and he's born to one of the cities that I consider my second hometown, Detroit, and raised in Panama, but was inspired to become a doctor as his dad was a medical oncologist for more than 3 decades. He graduated from the University of Navarra in Pamplona, Spain. And, thank you so much for taking the time for talking to us today, and Dr. Santamaria.
Appreciate you. Thank you so much. Very happy to be here, and I appreciate the initiative from the NHMA. So I would like to discuss only about 7 minutes about community healthcare workers, because this pertains to relate to cancer outreach activities that occur. So I believe in the next slide, I have a few pointers that I'd like to bring up for discussion. My focus in oncology, a big focus is community health navigators, cancer health peer navigators. These are individuals from the community who are, many of them, survivors of cancer or other illnesses. And most of these individuals are non-clinicians. So what is their role? Historically, there has been a lot of names for this, and a community navigator, a peer supporter, a patient advocate. There are many kind of different definitions that I think are in Omaha, Nebraska, we've created one for breast cancer specifically because we have seen the disparities of cancer care for these women in North Omaha and South Omaha, which is a segregated city. So we have trained individuals who identify themselves geographically, culturally, racially, and or ethnically with patients. And they themselves are cancer survivors and have undergone the experience of cancer in themselves or their families. And what these individuals with some training that we have provided to them and kind of sense of community, we have trained them to help patients who have cancer address barriers of care. And this can be simply trying to resolve anxieties or distress or fear just by the peer support alone, just by having a friend in their community who have undergone this and have survived it and doing well, as well as mitigating other social determinants of health, such as a big one, transportation, massive one, that we have, especially here in Nebraska, being a rural state. We have a lot of Hispanics and other underrepresented minorities who live very far away, so that they could get the care they need and participate in clinical trials is very difficult with transportation. Medical mistrust, health literacy are things that also we address in insecurities. And these are activities that have shown with evidence and studies and experiences to be to improve health outcomes, not just in oncology, but other illnesses and chronic diseases. And similarly, some of these programs have a special focus into trying to get these folks into clinical trials because of all the reasons that Congressman Ruiz has alluded to. We need better representation of patients in clinical trials, and especially also rural patients. So we can move to the next slide. And I wanted to also discuss briefly that historically, these community healthcare workers or peer navigators or supporters or patient advocates have done this voluntarily without really getting a big recognition or compensation or salary or stipend. Some programs exist and they do get some gift card or something, but nothing is really truly systemically official throughout the entire country. You know, different programs work different ways, but recognizing the effectiveness of community healthcare navigators and cancer navigators, there are new Medicare rules and the new physician fee schedule that started this January for the 2024 that introduce codes that we can start utilizing to get reimbursements from CMS for these services. These are the codes, G0023 and G0024, that can be incorporated in EMR and documentation. And these are services that can be provided by non-clinicians. Under the supervision of a clinician. The condition has to be chronic, like cancer, for example, lasting more than 3 months. And these reimbursements can aid with initiation and follow-up visits. There's a big emphasis of covering telehealth, very important for communities that are out there, far from us and hard to reach, rural, frontier, etc. And it also includes reimbursements for documenting and addressing social determinants of health. And so with these initiatives, we're starting to incorporate this in our practice with our navigators, and now we have an incentive from reimbursement from CMS, and I hope that commercial insurance will follow through. And we will continue to develop this program so that we can apply these rules and these codes and these reimbursements to promote clinical trials. And I think this will encourage patient navigation and enrollment in clinical trials. And together with initiatives like Congressman Ruiz, I believe that if we really focus on things like this and focusing on peer support, community navigators, patient advocates, folks who've undergone this experience and can help the communities because they know the problems that affect these communities and they identify themselves with those same individuals, and that we pay these advocates, these navigators, these individuals, because now we have a source of reimbursement from insurance, from Medicare, from Medicaid. I think we can make a huge impact. So I just want to present that here for my conversation in my 5 minutes. And I will be happy to follow with a discussion later on the panel for Q&A. I appreciate your time.
Thank you, Dr. Santamaria. You're absolutely right. This is a game changer with regard to the whole opportunity to even be involved in clinical trials and also for reimbursement. And also we have Dr. Estelamari Rodriguez, who is Associate Director of Community Outreach and co-lead of the Thoracic Site Disease Group of the National Cancer Institute designated Sylvester Comprehensive Cancer Center at the University of Miami Miller School of Medicine. I just want to emphasize that while there are so few people of color in these spaces like Dr. Santamaria and also Dr. Rodriguez, there are even fewer women. And so what we're seeing is a rarity and a unicorn. I just want to give her praise. She earned her medical degree from the State University of New York Downstate College of Medicine, fluent in Spanish. She has triple board certifications in hematology, oncology, and internal medicine. Thank you so much for sharing your time today, Dr. Rodriguez.
Thank you. I've never been described as a unicorn, but really glad to be here. Like Dr. Congressman Dr. Ruiz, I've been affiliated with NHMA for a long time since I was a medical student in Brooklyn, New York. And glad to be here. So the work that I do every day, I take care of patients with lung cancer. And also I just came back from my clinic where we have a phase 1 experimental therapeutics clinic here in South Florida. And I will show you the first slide. You know, when I work every day and we're trying to find patients for trials, what we have seen is that there's a lot of barriers. And if you look at the data, which is always good to kind of look at the data and look at what we have offered patients in the last 20 years, where there has been so many advances in oncology, from immunotherapy, from targeted therapies. We have patients with lung cancer that used to survive barely a year. Now we have patients that can survive 6 years on targeted therapy and patients that can be cured with immunotherapy. So all of that research was based on trials that did not include people like you and me. These trials from 2008 to 2018, on the left, you see the representation in clinical trials leading to cancer drug approvals. Is really sad that we have not enrolled patients who are Hispanic and Black to answer those important questions. So two things happen. Patients don't get offered innovative treatments early when they're don't have access to trials, but we also don't learn how these treatments are tolerated or not tolerated in our community. So this is definitely something that we have to change. And just to kind of bring it home, triple negative breast cancer, which we know takes a big toll in African-American women, some of the landmark trials of immunotherapy barely had African-American women enroll. So really, it's really a lot that has to do with the trial and really the way we're doing the work that we do that hasn't changed over 2 decades. And on the right, we can look at that the representation of minorities not only impacts Hispanics and African-Americans, but also American Indians and Alaskan Natives, where they're really not represented to the extent that they get impacted by these diseases. So next slide, a lot of work has been done to understand barriers. And I think this morning, Congressman Dr. Ruiz was talking about his experience looking at meeting patients in the emergency room and all the barriers that come into play for patients not to access great care. And the same thing happens for clinical trials. On the top right, there's all these things that impact patients not being able to make it to a trial. There's a lot of distrust of the medical system, so we have to own that and fix that. There's a lot of financial barriers where the Clinical Modernization Act will help, but there's a lot of geography. I mean, I work in South Florida, there's 6 million people here, and we have, one designated cancer center, but you have to travel sometimes 2 hours on traffic to be able to make it to this clinic. And not everybody has access in the middle of the state, in rural parts of the state. And really, it's really a luxury to be able to take time off for a trial. You have to be there sometimes multiple days to come back to sign a paper, to come back to do a lab. So it is a lot on the patient, and patients need social support, and they need support in terms of overcoming these barriers. Now, on the left side is all the stuff that the medical system should fix, that the Clinical Trial Modernization Act will kind of help some of that, but there's a lot of lack of awareness. There's a lot of bias. Patients get seen, African-Americans and Hispanic patients sometimes get seen as patients that don't have support and don't have the means, so they don't even get the opportunity of being offered a trial. And we have looked at, in our institution, and the cooperative groups have looked at minorities, and when they're offered a trial, they're as likely to participate as a non-Hispanic white. So we're likely to participate if we're given the opportunity and the resources to make it there for that trial. And then our institutions and our partners in pharmaceutical companies have not made it easier. We have these very complicated trials that require biopsies, that require many steps. So it's very difficult for patients, our regular patients, to be able to be eligible for this trial. So most patients that need trials don't have a trial they're eligible for because the trials are also very complicated. So another thing that needs to be fixed. And then I'll just end on what we're trying to do at the University of Miami. And this is kind of highlighting some of the work that Dr. Santamaria has mentioned in terms of outreach. So in the next slide, I will show you that we have taken outreach also with the use of community navigators, but kind of taking our clinics to where the needs are. So on the right, you have a map of our catchment area in South Florida. And we have kind of mapped where lung cancer, which is what I am interested in serving our community that is impacted by lung cancer. And they're not around where I practice in our main campus. They are really far north in Broward. They're very far south, and some areas that are kind of near us, but there's a lot of barriers, even like 5 miles away, to make it to a big institution. So these game changer mobile clinics, which have been pioneered by Dr. Kovets in our community outreach department, are really this kind of mobile clinics where we can do, we started doing screening and conversations, but now they're more sophisticated. We can have our electronic medical records. We can talk about clinical trials and screening. We can run screening for cervical cancer, prostate cancer, and do some innovative research in the community with the community. But I think to make this work happen, you have to have a voice. You have to keep showing up. You have to build trust. But we have been able, at least in the last year, to touch about 1,500 people at 220 events. So I think, again, a lot of work to be done, not only in terms of making trials easier, but also making trials feasible for patients and being able to take trials to where patients are. Thank you.
Thank you so much, Dr. Rodriguez. I guess the solution there is if the people can't get to you, you go to the people. That is such a wonderful and innovative way to solve an issue and a challenge that face so many individuals, low income, rural, urban, and others who don't have transportation. And as I said before, the American Cancer Society Cancer Action Network is a nonprofit, nonpartisan advocacy organization. We seek scientifically based or evidence-based public policy solutions to lower the burden of cancer for everyone. And while our CEO is Dr. Karen Knudsen, the president of ACS CAN is Lisa Lacasse, we are ultimately led by our volunteers. And one of those is Miss Beatrice Cardenas-Duncan. I'm going to call her Miss B, if that's okay. I always call people by Ms. Duncan, but they said it was okay for me to call you Miss B. She is a community organizer and health wellness advocate for the American Cancer Society. And like you, Ms. B, I volunteered for the American Cancer Society for 15 years. So, you know, Ms. B, thank you so much for your work, and thank you for sharing your story today.
Thank you so very much. Good morning, good afternoon. My name is Beatrice Cardenas-Duncan. I'm originally from Mexicali, Baja California, Mexico, and currently reside in San Leandro, California. I'm a proud mother, grandmother, and great-grandmother. I have a daughter, a son, 4 grandsons, and 6 great-grandkids. My husband passed away 10 years ago from pancreatic cancer. Throughout my professional career, I worked as a legislative aide for a San Francisco State Senator, Child Support Officer with the Department of Child Support Services, City and County of San Francisco, and in the hospitality industry. In 2011, at the age of 64, I obtained my Bachelor of Science degree in Organizational Behavior and Leadership, a 13-month accelerated program from the University of San Francisco. A Certificate of Completion in Nonprofit Leadership and Strategic Management from San Francisco State University College of Extended Studies, 2013. At the age of 71, I was awarded a master's degree in nonprofit administration, also from the University of San Francisco, 2018. Currently, I'm hoping to pursue a second master's degree in migration studies at the University of San Francisco. I have volunteered with ACS CAN for 17 years. I was diagnosed 12 years ago with chronic myeloid leukemia. During my diagnosis, I had the support of my husband and of my family. I was already in a treatment when my doctor brought up a clinical trial opportunity for me. I was not seeing improvement based on my treatments, so it was the right next step for me. Before starting the clinical trial, I did not know anyone who had participated in one before, but I kept thinking positively and hope my participation in the clinical trial will help continue my life and help me grow older and get to see more of my grandkids and great grandkids. I'm 76 years old. My oncologist is Latino, he's Salvadorian, so we share a cultural understanding. Sometimes we speak Spanish, and I feel like he really understands me. I am lucky to have an oncologist that shares my background, and I know that this has affected my cancer journey and experience in the clinical trial. My experience in the clinical trial has been very positive because there is a constant communication amongst my oncologist and the oncology pharmaceutical team that reviews my blood work, which I have every 2 weeks and at times once a month. They explain the indicators that at times that the indicators they show improvement and others that will be more closely monitored, which at times can be liver, platelets, white cells, red cells. I also can ask them specific questions. Their answers are essential for me to be able to be more aware and have a clear understanding of how my treatment is progressing. It is important for me to participate in a clinical trial because it gives me the opportunity to continue receiving the best treatment for my cancer. Additionally, it is a way for me to get back to the Hispanic Latino community. I know that my experience is helping to shape the experience of Latinos in the future. I have educated myself, my family, and my friends about my experience, and hope that this helps encourage more people to consider participating. I wanted to speak today, and I wanted to speak today because I want anyone listening to feel empowered to spread information about clinical trials within the Hispanic Latino community. I know that my participating has improved my life for the better, and I want that to be the case for others as well. For this reason, I hope we can gain more support for the Clinical Trial Modernization Act so that we can decrease barriers for participating in clinical trials. Thank you so very much for allowing me and inviting me to provide you with my personal story in my participation in clinical trial. Thank you so very much.
Oh my goodness. I mean, if you told me about all your achievements, I'm 64 and I'm pursuing a master's degree. Some of my friends said, James, why are you crazy? Why are you pursuing a master's at 64? Now, you're my inspiration. I mean, aside from us being cancer survivors, oh my goodness, that is simply amazing. What a wonderful life. And like you, I was a former widower too. My love to you and the loss of your spouse. So thank you very much for sharing your story. We have some questions for you later, but I just wanted to go on to, now we have another volunteer that Ms. Dulcely Tavarez, and we're going to hear from her, and she's going to share her story. Then after that, we'll go into some questions and answers. So Ms. Tavarez, thank you so much for being with us today. We can't hear it. Christopher?
One moment, please.
Okay. No problem. While we wait for the video to come up, I just want to emphasize that, Ms. B, as you said, the reason why I got involved in the clinical trial, as I said, 40 pounds and an afro ago, 1999, is because I wanted to try to help save lives and to come up with better treatment options. As I said, when I had prostate cancer, the surgery was a foot-long surgery, which eliminated my bikini modeling career. And also you had a catheter that came out of my body for 2 months. A friend of mine who's my exact same age had it, and do we have sound now? Oh,
Yes.
I was going to say the
Good.
situation is improved. I don't have it now. My friend who had prostate cancer has 3-inch incisions on two sides of his body. It's done robotically. The catheter is in for 48 hours and he's done. So, you know, those are some of the other changes that have been improved. Thank goodness thank goodness for a clinical trial, you know, that I participated in, but it was really because my doctor told me when I was in the hospital, you are going to be in a clinical trial because we need to improve the treatment and outcomes for individuals with cancer. And that really is what it was. So I think, Christopher, okay, we've got it. Then I'll be quiet and we'll listen to Ms. Tavarez.
All. My name is Dulcely Tavarez, 31 years old, a native New Yorker from a Hispanic Latino background. My parents migrated from the Dominican Republic over 30 years ago. I grew up in a tight-knit family in Upper Manhattan. In July of 2015, my world turned upside down, and at the age of 22, I was diagnosed with cervical cancer, stage 1B2 squamous cell carcinoma. Being diagnosed must have been the hardest obstacle I've ever encountered. It was scary, shocking, depressing, and I felt like I was in a funk for a while and I wanted to give up. During treatment, my tumor kept progressing, and after multiple admissions to the ICU for urosepsis, caused by a vaginal fistula, a symptom from my chemotherapy and radiation treatment, my medical team talked about trying out a clinical trial. Although they did confirm that the medication was not yet approved for cervical cancer, it showed promising results in the treatment of lung cancer. It made me feel a little uneasy as I didn't know anything about immunotherapy. I didn't know anyone who had participated in a clinical trial, and I've never heard of the medication that they wanted me to use. But through this all, my experience was amazing, and I'd like to think that it's the reason that I am alive today. It seemed that the standard of care treatment wasn't doing anything for me. So when I was offered the clinical trial, I felt like I had nothing to lose. It was my chance to try and rise from this disease. I feel fortunate because during most of my cancer journey, I was on short-term disability and living with my parents. Therefore, I didn't have to worry about paying any bills and felt my barriers were little to none. And I know that that is not always the case for others. It was important for me to participate in this clinical trial because I was very young when I had cancer. There were still so many things I wanted to do, and even though everything in me wanted to give up, mostly because of my treatment side effects, I still wanted to live. And the clinical trial gave me that chance. I think it's important to be part of clinical trials because they give us hope and advance all aspects of the disease. Today, I proudly declare myself cancer-free. Motivated by my personal journey, I pursued a career in health services, holding a bachelor's in health services administration and a master's in organizational leadership. I remain committed to helping others because I've seen the power of clinical trials. The Clinical Trial Modernization Act, HR 8412, can impact countless lives and improve many more. I urge you to support this bill, harnessing science, and hope to create a brighter future. Thank you. All.
Thank you so much, Ms. Tavarez. That was such an amazing story, and the odds of overcoming two things, one, cancer, and then coming back to get advanced college degrees is simply amazing. I mean, I'm just in awe and humbled by that. And you know, now we're going to move on to our panel discussion. Oh no, I'm sorry. I think we have another slide that talks about the legislation. Is that the next slide? If not,
yeah, so that will be given towards the end of the
okay,
discussion.
thanks. Well, now we have our panel discussion. And if you have any questions that you'd like to ask this panel, please come on board and get on board and type them into the chat, or let let us know. We'll get your question on board. And I just want to take a point of personal privilege and let the first questions be to you, Ms. B, about today. And I want to ask you some basic questions. Why is it important for you to participate in a clinical trial? How did your oncologist make you feel comfortable participating in the trial? Is there anything you want someone to know who's considering participating in a clinical trial?
I just feel very honored that I was chosen to participate in this clinical trial, because I feel that the legacy that I would leave is the fact that the health solution that was found through this medication will be essential to our Latino community. My oncologist has always been very persistent and consistent in making sure that my health continues to improve. And that is really something that I truly appreciate. Not that others don't, but for them to take the time, and make me feel comfortable and understand what exactly is going on with my body, with my health. Also, I think it's important that when I get the blood work results, right away they're sent through my email. And I can click into that and begin to look at the areas, like I said earlier, that would need more monitoring. I'm becoming more familiar with the terminology, with the graphs, what exactly, at what point am I, and at what point would be more critical. So I think that's the reason why it's essential to participate in clinical trials, because we become more aware, we become more educated, and we become more sure that their health will continue to improve.
How did your oncologist make you feel comfortable?
The reason is that it's that relationship that we have established. And that is really important. The concern that he demonstrates during our phone conversations or visits. And that's one area that it makes me feel very comfortable, because the sincerity that is demonstrated coming from him to make sure again and again that my health continues to improve. And I said earlier that perhaps I have a longevity, maybe to reach 100 years old. No, but it's just important to have that kind of relationship. And I'm sure that the doctors here present do that, and I commend them, because it makes us feel more comfortable, and it makes us give them an idea or enthusiasm to look forward that we will continue to live a long life.
Thank you. And I know you said this once before, but I just wanted to ask, what do you want people to know who are considering participating in a clinical trial? I'm concerned about it. I don't know if they're going to be experimenting on me. What do you have to say about that?
I think that that's very important. And as both doctors stated about the outreach that they're doing, we need to continue to be particular involvement in our Latino community, Latino Hispanic community, to diffuse this kind of mentality that for whatever reasons have been established. Oh, I'm not going to get anything in return. And, why should I participate? So it's just continuing to educate our community, to have the promotoras, to have the meetings with clinics that are able to bring some kind of a consensus and be able to say, it's important, but it's explaining it in clear language that we can feel comfortable when we walk out of that presentation. This is what is important, continuing to educate and outreach into our Latino community. And again, if we continue to do that, we will dispel, like I said earlier, any kind of a concern. Yeah, there's some concerns that are going to happen, but if we can diffuse that with clear understanding, clear education, I think that we can achieve a greater participation. And of course, the financial aspect and so forth and so on, which this legislation will be able to address.
Thank you. Thank you so much, Ms. Duncan. I'm going to call you Ms. Duncan, Ms. B. Thank you so much. That's simply great information, and many of the same sentiments that I have, even though, we're about the same age and all that, we had similar experiences. So thank you. I really wanted to have this next question for Dr. Rodriguez, and I see Dr. Santamaria, you've already kind of answered it. It came up in the chat. At what point after diagnosis do you recommend looking into a clinical trial? For me, I was still in the hospital bed when the doctor told me, James, you're going into a clinical trial. So just wanted to ask Dr. Rodriguez, what point do you consider that? And I know you answered it, Dr. Santamaria. Just wanted to let the audience at large hear it as well.
So There's different types of trials. So a lot of the trials that we do in experimental therapeutics are for patients that have not responded to the standard treatments and they're looking for new options. So those trials need to exist because that's how the science moves forward. And we need our community to know that those trials are not, they're called experimental clinics, but they're not really experiments in the sense that people are using you as a guinea pig to test a drug. They're really trying to find something that will work. And there's a lot of regulation in terms from the FDA that this will be a safe process for patients. But some of those trials that patients participate are like patients where they're trying to find the dose. And we do know that some patients end up getting a lower dose than when it eventually gets approved. So those are a particular set of patients that will benefit from those, like that, those finding trials, which are called phase 1. There's a lot of other trials for every patient. I mean, there are trials for patients in the community who are doing screening. There are trials about what are the best way to manage side effects. And then the trials that we all need are the trials that move the best treatments to everyone in the community. So those are like large phase 3 trials, and some of them are international. So there is a lot of different trials. And I guess what I will communicate is that my grandmother had cervical cancer. I grew up in Puerto Rico, and I remember her relationship with doctors was about trust, but was really whatever they said she will do when she had her cervical cancer treatment. But I want our community to know that they have you have rights, and yeah, you advocate for yourself and you ask questions. And if you don't have enough questions and you don't feel comfortable with a consent form, it is your right to ask again and ask for more information so that you can make the best decision for yourself. Yeah, your doctor, especially if you have a good relationship, they will recommend what they think will be best. But I always tell my patients, you're in charge. You could always sign out of a trial. Like if you sign up and you change your mind, that's also allowed. It's not a binding legal document in that sense, but it is an important thing that we contribute, that we get data about how our community tolerates treatment and we find better cures for our own people in our own communities, our families and other members of the Hispanic community.
Dr. Rodriguez, I hear in your response, it's important that we be our best advocates and that we continue to ensure and let us know about our rights. And it's also important that doctors are listening to us, are culturally aware and sensitive. And of course, from a language perspective, making sure that they're speaking in the language and also speaking in the culture so that others can have the best outcomes for themselves. And, Dr. Santamaria, you have, I think, an advantage over everyone here in the panel today. Your dad was an oncologist for over 3 decades. And so you're a doctor now. How do you think clinical trials have helped in the treatment that you saw your dad doing to where we are today?
Yes, thank you. Yeah, I have big influence from him. When I was a teenager in Panama, where I was raised, he was working in the National Cancer Hospital, and they actually had a clinical trial open for breast cancer with a new drug called trastuzumab Herceptin, which is now has saved so many lives in the entire world because it specifically treats a breast cancer population. So I was an early witness of a practice-changing study on patients in a clinical trial in my native Panama. So that really left a mark on me. And I agree completely with everything that Dr. Rodriguez says. I have a little bit of an advantage seeing it for kind of like an external eye, firsthand as a young Hispanic individual growing up in Panama with a father oncologist. And I don't know, I'm kind of steal a little bit of the moderating, but I saw a question here from Nancy Valencia that I would like to address next, is that a lot of folks that are offered clinical trials, and this is not just minorities or Black or Hispanic or underserved, every individual sometimes asks us, this is just experimenting on us. That is the argument that there's a lot of medical mistrust that exists. And then what is the argument? I would like Dr. Rodriguez also to tell us what is her kind of to-go argument. My to-go argument is you're not a guinea pig. The treatments that are reaching this stage already have been tested in many different ways to try to, to make them safe and efficacious. And phase 1 could be an exception to some degree. But the only way to advance science and knowledge and treat and a new cancer treatment is efficacious And also that's why we want the minorities and the representativeness of the population to be sure that it applies to everyone, is to get patients in clinical trials. And my counter to them is that if you participate in a clinical trial, you could be benefiting from a treatment that is going to be a standard of care in the future. This might be the latest and the newest treatment that you can get. It also, to some degree, is going to have doctors and coordinators and research people being more on top of your care. So you are going to have great care. Also, it's an altruistic, a lot of folks could see it from an altruistic perspective. If they participate in a clinical trial, I'll tell them and I explain them, you will be benefiting future patients like yourself, because we will have the answer and we will have the result, and we will know if the things that we're doing are working or they're not working. You will help patients and folks like you in the future as well. So from the altruistic point of view, I try to kind of also have patients sign up for a clinical trial. I briefly mentioned all the regulations and all the advancements that exist in ethics, medical ethics, and the medical mistrust that has built from the past, and we validate it and we recognize it and we feel it that is still very present in our communities. We fight against that, and we have methods, and we have regulations, and we have protocols and conventions and stuff to try to mitigate the guinea pig feeling of patients. But kind of burp it a lot out there. So I would like to ask Dr. Rodriguez, what do you do for the patient that tells you you're just gonna experiment in me?
Thank you. I mean, I think that you mentioned it, like we first have to acknowledge it. So I come from a Puerto Rican community that in Puerto Rico and in New York, at some point, our elderly patients remember that there were contraception, reproductive health, mistrust, because there was really abuses of women going to trials where they didn't consent to be sterilized. And that's a reality. My mom remembers that, my grandmother remembers that. And some of our patients remember that. And our African-American community remembers why there's this trust. They remember the racism that is still happening. So I think you have to acknowledge it. But I think the workforce diversity is the key. I think we are very lucky in South Florida. I'm not a unicorn. We have a lot of Spanish-speaking physicians here in Miami, but we also have a lot of support staff, community health worker, nurse practitioners, nurses that really care about our community. They spend more time than the doctor spends trying to make patients feel comfortable and giving them the tools to advocate for themselves. So I think for that patient that has this trust, I first kind of have to listen to see where it's coming from. Did a family member had a bad experience? Did they remember their grandmother talking about something that happened? Is it a language barrier that it contributes to the mistrust, and how we can help that? And I will tell you, I open clinical trials all the time here that come from pharmaceutical companies that don't have a Spanish form. And I'm like, we 50% Hispanic community. You can't bring me a trial that doesn't have a Spanish translation. So that, number one, delays research. And number two, it shouldn't happen in 2024. Like, it's very easy for ChatGPT to translate a consent. So I just feel like there's a lot of solutions, and we have let things be the way they are all the time. And we need to kind of change the paradigm. That's what we need advocates like Ms. B to really tell us their stories and really move the needle and help patients advocate for themselves.
That's a great response. Again, I think we're all, the least common denominator is importance of advocating for yourself. And, Dr. Santamaria and Dr. Rodriguez, I go out and I try to get more men in particular getting screened for prostate cancer. I tell them, they say, well, and I told them I participated in a clinical trial. So I use my example. If I had not been in a clinical trial, the second recurrence of my prostate cancer would probably have been later and probably would not have been treated as easily with radiation as it had. So I use myself as an example. And like you, I acknowledge it. I acknowledge the fact about Henrietta Lacks and her cells that were used at Johns Hopkins, the Tuskegee experiment that happened in there. But I also acknowledge the fact that an African-American woman led the COVID task force to come up with a new COVID vaccine, and they started at HBCUs. So comparing then to now is like comparing a Model T to a Tesla. They're two completely different situations. And I'm gonna say, Doctor, you're going to get a PhD pretty soon, Dr. Duncan. But
I wanted it.
I know you wanted to say something. Go ahead.
Yes, I just wanted to comment on what you said, James. We are a biracial family, and my four grandsons are Black and Mexican, and I have an 18-year-old. So this concept and the issue that you are discussing is very important to me because, of the history that Black men have suffered throughout the years. So now I try to educate my grandsons and my 18-year-old that just graduated from high school about the ramifications of not being seen by the doctor on a consistent basis, so educating that aspect is very, very important. So thank you for that. And we will continue to push for better health availabilities, and to be able to prevent this kind of cancer.
Yes. Thank you. Thank you so much. And I want to know if there were we have a few minutes left. Just want to know if there were any more questions from anyone else. And if not, we can start to wrap up our presentation today. I know doctors, you both have busy schedules and patients to see. So,
I see a few more questions, I think, in the Q&A.
Okay.
And I don't know if you see them, Dr. Rodriguez and
Yeah,
Mr.
I see
Williams.
a great question and an example of what new technology can do. So there's a question about instead of having this game, having patients come to a hospital to go through all these screening tests, can we do blood-based testing to screen for cancer? And we use blood-based testing to monitor cancer recurrence. So there's a lot of new technology and exciting work, but this is what we're talking about. If we don't include our community in those trials, we don't learn anything. So yes, you could develop a test. I will tell you the National Lung Cancer Screening Trial that is very dear to my heart was paid with our tax money, 50,000 high-risk smokers. It had 1.9% Hispanics, 4% Blacks included, 90% non-Hispanic whites. So this is a trial that defined the screening for lung cancer that didn't learn about our community, and then later was revised to make the age less to include more Blacks and women, and really kind of think about smoking history in a different way that was not as restrictive. All of that could have been averted if we had been part of the process of developing the trial, if we had tested the trial in communities that are impacted the most. And I think the same thing with these new technologies like blood-based testing, I think is great, but we really have to invest and do the work in our community so that these technologies are applicable to our patients that we serve.
Thank you. Thank you very much. Thank you so much, Dr. Rodriguez. Thank you so much, Dr. Santamaria. Now we have to move. Okay, that's the end of our panel discussion. Just want to get to a couple more pieces before we wrap up here today. On the next slide, we have more information and want to give some information about the access to clinical trials. And there's a bill that Congressman Ruiz mentioned earlier, HR 8412, and that's the Clinical Trial Modernization Act. And, without going into all of the details, I just want to say that I worked on the Hill for 20 years. I was a former chief of staff to Congressman John Lewis from Atlanta, Georgia. And whenever he presented with a problem, he used to always say, so what are you going to do about it? Well, thank you, Dr. Ruiz and Dr. Bouchon have introduced this bipartisan legislation that will, among other things, authorize grants to encourage clinical trial enrollment, encourages clinical trial participation by underrepresented populations by authorizing payment. That's one of the biggest barriers for individuals to get back and forth for food, lodging, transportation, and provision of digital health technologies, increases clinical trial accessibility by allowing clinical trial cost sharing of co-pays and co-insurance, and finally excludes this from gross income for income tax purposes. So essentially, it's not going to cost you with regard to income taxes, which are the biggest hurdles to the bill that's been introduced. And we're going to try to get as much support as possible to try to get this bill across the finish line and signed into law. And finally, we have some upcoming events, because one thing that we know is you got to get involved. Both Ms. B and I got involved at the volunteer level, but and while you may not personally be affected by cancer, you certainly know someone who has. And here's how you can get involved in future webinar opportunities. On July the 16th at 1 p.m., there's a medical school roundtable that talks about careers in HIV treatment. And you just can follow the National Hispanic Medical Association on social media and on their website for more information, and also for more ways to get involved in the upcoming events and how you too can be a participant and an active advocate for those with cancer and other diseases that affect all of us. So as we get to the final slide and we're going to wrap everything up, I want to thank everyone here. I want to give thanks to Dr. Ruiz, Dr. Rodriguez, Dr. Santamaria, Ms. B, Ms. Tavarez, the National Hispanic Medical Association, the American Cancer Society, and the American Cancer Society Cancer Action Network, and everybody who's been on this webinar today and watching it for participating in today's webinar. And again, like Congressman John Lewis would say, what are you going to do about it? What are you going to do to be an advocate for your health and to lower the health barriers for everyone? Look, we're all volunteers and and there are doctors here, but that's ultimately, you have to be the best advocate, not just for yourself, but for your family and for those who love you. And with that, I want to say thanks so much. And thanks to everyone for taking the time to participate today. Thank you. Be blessed, everyone.